Clinical communication criterion C3, providing structure, is where consultations live or die on the clock. Most international medical graduates assume that providing structure simply means inserting basic sequence words like firstly, secondly, or finally into their speech. That is a dangerous oversimplification. In the 5-minute OET consultation, examiners are not testing your ability to recite a list. They are measuring your ability to command the timeline, control conversational velocity, and prevent the patient from hijacking the consultation layout. When a candidate lacks structural mechanics, history taking bleeds past 3 minutes. The management phase gets crushed into a panicked 30-second rush, and the consultation collapses. In this video, I am going to decode the 2 primary structural hazards that trigger timeline failures, and show you how to execute the 3-minute hard ceiling and the consultant drop to maintain absolute command of the room. The most frequent structural failure in OET medicine is what we call timeline hijacking. It happens during stage 2. When faced with a talkative, anxious, or detailed patient, candidates allow the patient's conversational speed to dictate the clock. They ask open-ended questions late into the 3rd minute, inviting long narrative detours. Observe the live acoustic intercept on your display as a candidate allows their timeline to be hijacked at the 3-minute mark.
I see, Mr. Davies. And tell me, is there anything else at all about your lifestyle, your sleep, or your work stress that you think might be contributing to these headaches?
Analyze what just happened. It is 3 minutes and 20 seconds into a 5-minute examination, and the candidate is still opening up new diagnostic pathways. The patient will now talk for another 30 seconds about their sleep patterns. By the time the doctor reaches the management phase on their candidate card, they have less than 60 seconds remaining. They panic, rush their advice, skip crucial safety netting steps, and fail criterion C3. You cannot provide structure if you do not control the clock. Passing criterion C3 requires enforcing the 3-minute hard ceiling. In the 5-minute consultation masterclass, the 3-minute mark is the absolute point of no return for history taking. Regardless of how much diagnostic data remains on your card, you must close stage 2 and explicitly transition into stage 3 management before that timer hits 3 minutes. To execute this without appearing abrupt, you deploy a signposted structural pivot. Analyze the architectural mechanics of this masterclass transition.
Mr. Davies, thank you for clarifying those details. We have a clear picture of what is driving these headaches. To ensure we make full use of our time today, let's pivot straight to your treatment plan and look at how we can get this pain under control.
Look at the structural mechanics. You validated the history phase. Thank you for clarifying. We have a clear picture. You explicitly signposted the transition. Let's pivot straight to your treatment plan. You justified the boundary using temporal authority to ensure we make full use of our time today. The patient feels guided, the diagnostic loop is safely closed, and you step into management with a full 2 minutes left on the clock. The second major structural failure occurs during management: conversational drift combined with a flat cadence. When doctors deliver complex medical advice, they often deliver a continuous, unstructured block of text without categorizing the information. Not only that, their vocal pitch remains flat or trails upward at the end of sentences, which acoustically invites the patient to interrupt. Listen to this unstructured execution.
So we need to start you on blood pressure medication today, and you also need to reduce your salt intake and start doing some regular exercise, and then we will review you in a month.
This is an information blur. Because there are no distinct structural boundaries or vocal markers between the medication, the lifestyle changes, and the follow-up, the patient's brain experiences cognitive overload. They interrupt, ask off-topic questions, and pull the consultation off course. To maintain structural command during management, you must combine explicit categorization with a physical acoustic technique called the consultant drop. First, You categorize your management card into clear, labeled agenda blocks before delivering a single detail. Second, as you complete each structural heading, you execute the consultant drop. You lower your chin slightly on the final syllable of the signpost to drop your vocal pitch downward. This downward inflection acoustically signals clinical authority and stops interruptions before they start. Analyze the pacing and tone of this masterclass execution.
Mr. Davies, our management plan today focuses on three distinct areas. First, initiating your prescription. Second, key lifestyle modifications. And third, setting up our clinic review schedule. Let's start with your medication.
Observe the structural precision. You signposted the total macrostructure, 3 distinct areas. You mapped the exact agenda before diving into details. Prescription, lifestyle, review schedule. By dropping your pitch at the end of the agenda map, you projected absolute authority and set an immovable framework for the rest of the consultation. This is the exact definition of criterion C3. You signposted the sequence, categorized the clinical data, and dictated the pacing of the room. Providing structure in OET medicine is not about passive politeness. It is about active temporal control and clear information architecture. If you find yourself running out of time during history taking, or if patient interruptions consistently ruin your consultation flow, your structural boundaries are fundamentally leaking seconds. Do not wait for exam day to test your pacing under pressure. Click the link in the description below to run my free timeline integrity audit. This interactive diagnostic tool will calculate your exact risk of a structural collapse and show you precisely where your layout is failing. Run the audit, lock in your structural boundaries, and I will see you in video 4 as we decode criterion C4, information gathering.